The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series. My name is Shannon McKernan, and today I'm interviewing Dr. Betty R. Ferrell from the City of Hope Medical Center, lead author of Integration of Palliative Care into Standard Oncology Care, American Society of Clinical Oncology Clinical Practice Guideline Update. Thank you for being here, Dr. Ferrell.
Thank you. I'm very glad to participate.
First, can you give us a general overview of what this guideline covers?
Yes, this is a really important time for palliative care and oncology, and so it was very timely that we had the opportunity to update the ASCO clinical practice guidelines on palliative care. In this edition of the guidelines, we emphasize the importance of palliative care being provided concurrently with standard oncology care. I want to really acknowledge how important ASCO's leadership has been for the field of palliative care. ASCO has stepped up to create these guidelines and to do many things that have incorporated palliative care as a priority area. And this has been an outstanding role model for other fields. So, for example, people caring for patients with other chronic illnesses, such as cardiology or pulmonary disease, have looked at ASCO and they've seen the benefits of integrating palliative care. And so now what we see across the healthcare system is that palliative care is also being extended into end-stage heart disease and pulmonary disease, dementia, many other illnesses that create patient and family burden. And so these guidelines and ASCO's leadership in palliative care is also impacting the entire healthcare system, and ASCO has been a role model. I would also just add that the ASCO guidelines are very much in concert with the national guidelines for palliative care. So the national guidelines are created by the National Consensus Project, and the next edition of the guidelines of the NCP will be released this fall, October of 2018. And the fourth edition of these NCP guidelines emphasize, as ASCO has done, the importance of early integration of palliative care and concurrent palliative care with disease-focused care. And so ASCO members will be, I think, very interested in reviewing the NCP guidelines when they become available this fall, and also seeing how ASCO's work is very much in line with the larger national agenda for advancing palliative care.
And what are the key recommendations of this guideline?
There are really three essential points, and these also reflect the revisions or really the updates to the guideline. The first and I think overarching theme is that patients with cancer in the inpatient as well as outpatient setting need palliative care to be provided early in the course of their disease and concurrent with their oncology care across all stages of illness. Within that overall recommendation, we really emphasize that patients with advanced cancer need to receive palliative care earlier, so we recommend within 8 weeks of a diagnosis of an advanced disease. The second key point is that patients who have symptoms or quality of life concerns that are related to their disease or treatment need to receive palliative care. And the third point within this updated guideline is to really bring attention to family caregivers, who are the ones who are really providing the 24-hour-a-day care for people with cancer.
And what are the major changes from the 2012 version of this guideline?
I think the changes build on the increased body of evidence. There has been a pretty significant increase in the evidence available to us about the outcomes of palliative care. And an ever-growing body of evidence has documented that patients who receive palliative care are having much greater outcomes and benefits. So, for example, palliative care is documented to improve physical symptoms as well as psychosocial symptoms. Palliative care is leading to patients being able to stay on treatments longer and to be more successful in their disease-focused care. And there is a growing amount of evidence that patients who receive palliative care actually live longer, which may seem surprising in some ways, but in other ways it shouldn't be surprising at all. When patients can eat and sleep and their pain is under control and our psychosocial support is present, it allows them to do all of those things that we know helps to sustain life. So palliative care improves not only quality of life, but quantity of life as well. I think one of the other elements that readers will see when they look at the guidelines is the statement that's made under the recommendations about family caregivers. We all know that what is happening in oncology care is increasingly patients are being treated on an outpatient basis, and so what that really means is they are in their own homes. And so the ASCO Guideline Committee recognizes that if family members are going to provide this very complex care of cancer patients, we need to really be giving much more attention to support of those family caregivers. The recommendations state that for patients with early or advanced cancer, when family caregivers are providing care in the outpatient setting and in their homes, that we need our interdisciplinary teams of nurses, social workers, physicians, who can provide support to these families through education, referrals, telephone coaching, so that we can really support the family so they can support the patient. The guidelines also acknowledge that when patients live in rural communities, that they may have fewer resources. And so I think there's also great opportunities to expand the community outreach of palliative care. So I think overall, when ASCO members are looking at this guidelines, they will really see the emphasis on getting advanced cancer patients connected with palliative care much earlier in the course of the disease, that patients' symptoms and quality of life concerns are important for every aspect of the cancer trajectory, and then finally, that supporting family caregivers will be even more important in the future as our care shifts to the outpatient and home setting.
Great. And finally, how will these guideline recommendations affect patients?
These guidelines are very much focused on patient care, and they're very patient-centered. And I think if you look at the individual recommendations within the guidelines, what you'll see is that these should really change the way that we practice in oncology. So, for example, we know from very, very abundant evidence that unfortunately patients still get referred to hospice only days or perhaps a few weeks before they die, and people also do not get palliative care until months into their disease and treatment. So these guidelines should change the timing. We should be getting patients referred to palliative care much sooner, and we certainly should be getting them into hospice much sooner. The guidelines should really change the way that we integrate palliative care concurrent with standard oncology care. So as an example, here at City of Hope, in collaboration with our colleagues at Johns Hopkins, Dr. Tom Smith, who co-chaired the ASCO guideline panel with me, we are now conducting a randomized trial of patients who are on phase 1 clinical trials to test a randomized trial of patients who receive palliative care while they're getting a phase 1 trial. And so this is the best of both worlds. We want to advance oncology by supporting clinical trials and supporting advancements in the treatment of cancer, but the best way to do that is to integrate palliative care as a part of standard oncology care.
Great. Thank you for your time today, Dr. Ferrell, and thank you for your insights on this guideline.
Thank you. I'm very glad to participate and really appreciate ASCO's support of palliative care for patients.
And thank you to all of our listeners for tuning into the ASCO Guidelines podcast series. If you've enjoyed what you've heard today, please rate and review the podcast and refer the show to a colleague.